COVID-19 in the community. Prepared and presented to you by Group 2. Members: Juvirose Yi, Janelle Torreda, Harshpreet Kaur, Arshdeep Kaur, Mandeep Kaur, Pratpal Kaur, Harmandeep Kaur. After this presentation, you will be able to describe coronavirus, recognize symptoms, define and understand contact tracing, explain commonly used terms such as isolation and quarantine, describe the different roles and responsibilities of the healthcare team, recognize complications of COVID-19. To start, COVID-19 is a coronavirus which causes a severe acute respiratory syndrome and has become a global health threat. So how does COVID-19 affect the body? Most cases of coronavirus infection are mild and resemble the flu. First, it starts out as a dry cough and a low-grade fever. Then the inflammation causes fluid to accumulate in the lungs as the immune system fights the viral infection. Then the fluid in the lungs makes breathing more difficult for the infected patients. Moreover, blood oxygen levels fall below the normal range. Symptoms become critical when an outsized immune response to the viral infection leads to sepsis and a dangerous drop in the blood pressure, which is a condition known as septic shock. Bodily organs fail to function due to the lack of oxygen, the presence of inflammation, and the occurrence of septic shock. Contact tracing is a key strategy to controlling the spread of infectious disease, which focuses on tracing the contacts of the infected individuals with the goal of limiting subsequent spread should those contacts become infectious. Contact tracing, notification, and follow-up is a process that is used to identify, educate, and monitor individuals who have had close contact with someone who is infected with the virus. These individuals are at a higher risk of becoming infected and sharing the virus with the others. Contact tracing can help individuals who have been in contact with a case of COVID-19 understand their risk and limit further spread of the virus. Ontario's local public health units are responsible for COVID-19 contact tracing and case management. Ontario residents who have COVID-19 are contacted by their local public health unit to identify the persons they were in contact with and could have transmitted the virus to, and supported throughout their self-isolation period. Public health units also follow up with contacts of COVID-19 cases to check in about symptoms and to provide additional supports as needed. Isolation refers to the separation of an individual who is showing symptoms that is believed to be infected. Quarantine refers to the separation of an individual who is believed to be exposed but currently not ill. If an individual becomes symptomatic, he or she will be isolated and hence shall receive health care. Symptom monitoring is the assessment of symptoms at regular intervals of an individual believed to be exposed but who is not ill. If symptoms are then detected, the individual is placed under isolation. Health-seeking behavior is the act of seeking health care during the presentation of symptoms leading to isolation. So, how is the community dealing with the pandemic? Primary care networks and patient medical homes enable a COVID-19 response that is patient-centered and rooted in community and primary care. This is a critical response as approximately 90% of COVID-19 patients will recover from the virus without requiring treatment in a hospital. Primary care physicians, such as family physicians or nurse practitioners, and their multidisciplinary teams caring for patients throughout the COVID 19 pandemic will support continuity of care and enable a timely response if a patient requires more intensive support, including face to face assessment, add on treatment or available resources, and transfer to emergency department. The patient journey for COVID 19 positive patients requires access to different parts of the healthcare system. Without coordination across both system and organizational boundaries, there are risks to gaps in planning or communication or adverse patient outcomes. The volume of patients and time pressures of the COVID 19 response requires clearly articulated roles and responsibilities for each group in the healthcare system. In a non COVID case scenario, the patient has the responsibility to practice physical distancing, follow other public health direction about COVID 19, and self monitor for symptoms. The primary care networks are the ones who make arrangements to provide primary care to patients virtually or in person, monitor and manage vulnerable and complex care patients, and support COVID 19 response in their practice, including patient mental health and well being. They also provide support for a patient's social determinants of health that may prevent her or him from being able to follow public health guidelines. They reinforce public messaging within primary care environment. They also ensure ongoing advanced care planning and goals of care designation conversations and decisions. The public health needs to provide a clear and concise messaging to the public regarding physical distancing and staying healthy. They should also provide additional supports for vulnerable populations required to follow public health guidelines. In a scenario where the patient is showing respiratory symptoms, the patient is responsible to begin self-isolation. He should complete an online self-assessment tool and include primary care provider contact, receive call to schedule testing, and confirm primary care provider is copied on lab requisition. Primary care is responsible to assess to determine if patient has emergent or non-emergent symptoms. Direct patient with emergent symptoms to emergency room. Direct patient with non-emergent symptoms to online self-assessment tool. Monitor and manage patient in the community based on presumed or confirmed COVID 19 primary care pathways, and document appropriately for COVID 19. The public health is responsible to provide clear and concise messaging to the public regarding self-isolation and quarantine, provide direction on patient eligibility for testing. If a patient presents with symptoms at acute care site, the acute care health providers should notify the primary care provider about the patient admission due to emergent symptoms. Notify primary care provider of patient visit and discharge from the emergency department to support recommended follow-up and monitoring. If unattached, support patient in finding a primary care provider. As early in the admission as possible, work with care teams to anticipate need for information or assessment in home living environment. And lastly, home living and supportive living should work collaboratively with the appropriate care team to ensure any relevant information needed for appropriate clinical and non-clinical community supports such as assistance with meal preparation, managing finances, etc., are arranged for patients, families, and caregivers. Professional and support services are based on a client's assessed needs.
Here is a roadmap created by the Canadian government on patients who tested positive for COVID. When a Canadian who follows public health directions develops symptoms for COVID 19, he or she gets tested for the disease right away. If he or she receives a positive result, he then receives care, monitoring, and management. Once the patient is free from the disease, discontinuation of isolation occurs. So once the patient receives positive results, he or she participates in contact tracing. He continues to self-isolate and monitor his own symptoms. Primary care providers, once notified, monitors and manages patient in the community based on zone-based presumed or confirmed COVID-19 positive primary care pathways. Primary care nurse provides contingency plans that support attachment and continuity of care for unattached patients, orphan patients whose usual PCP is unavailable, and after hours or weekend supports. Public health report all confirmed and presumed COVID-19 cases. If patient provides PCP information, send results to primary care practitioner. Acute care, if swabbing is completed in these sites, notify primary care physician of positive result, notify patient of positive results, and provide clarification on isolation and quarantine requirements while in the hospital. As for home living and support living, ensured care is optimized for patients within the community. Collaboratively work with the appropriate care team to ensure any relevant information needed for appropriate clinical and non-clinical community supports are arranged for patients, families, and caregivers. Professionals and support services are based on a client's assessed needs. For receiving care, monitoring, and management, patients will still continue to monitor their symptoms with the support of their primary care physician or their primary care nurse. As a primary care physician, you still accept the responsibility for monitoring and managing COVID-19 positive patients. Ensure the continuity of care as per standards if unable to follow patients. Book virtual appointments to assess clinical risk, monitor and manage patient in the community based on the presumed COVID-19 positive primary care pathways, and in partnership with public health, ensure patient is able to safely self-isolate and refer to appropriate resources as needed. Connect with MOH for concerns or questions around patients' self-isolation and or compliance. Assess COVID-19 specialist advice when appropriate and consider additional community supports that may be appropriate for patients depending on their care preferences and clinical needs. Have ongoing advanced care planning and goals of care designation, conversations, and decisions which are fundamental to a person's care and support. For roles of primary care nurse, for patients requiring care post discharge from acute care, establish transition processes that support receiving safe handoffs from hospital, emergency department, or UCC back to the primary care provider. In the acute care setting, establish transition processes that supports safe handoffs from hospital, emergency department, or to the primary care provider. Ensure patient has a primary care provider and make provider aware of the admission. Create a plan to support patients with complex care needs, including social determinants of health and vulnerable population needs. Consider additional supports that may support discharge, including virtual hospital if available. As early in the admission as possible, plan for discharge by working with care teams to anticipate needs for information or assessment in the home living environment at discharge. Notify MOH of discharge from acute care. Notify primary care provider of discharge. Consider additional supports that may support discharge, including virtual hospital if available. As for home living and support living, Ensure care is optimized in a person's home and in line with their goals of care. Ensure care is optimized for patients within the community. And for more information about activities and exercises to help with physical concerns, strategies for day to day activities impacted by COVID 19, and information on what services and support are available or in person or virtual visits, consider calling Rehabilitation Advice Line. Once you are free from COVID 19, the patient still monitors symptoms with the support of the primary care provider. He or she continues to isolate as directed by public health. The role of the primary care provider. After patient has been cleared from isolation by public health, he continues to medically manage patient based on clinical judgment. As for the role of public health, the institution notifies patients of clearance from self-isolation, notify primary care provider when self-isolation has been cleared for the patient. For home living and support living, ensure care is optimized for patients within the community.
Before we proceed, let us take time to stand up from our seats, stretch out our hands and feet, have a sip of water, or have a bite of a cracker. Have you done it? Now, let us continue and don't forget to write down any questions that you have and feel free to ask us at the end of this presentation.
Respiratory complications of COVID 19 in the community. COVID 19 causes breathing difficulty and causes inflammation inside the lungs, leading to pneumonia. It affects both the lungs, in which the fluid gets filled in the air sacs, causing cough and breathing problems. It has been seen that even after the recovery, this lung damage may take further 4 to 6 months to resolve. Symptoms include rapid heartbeat, shortness of breath, rapid breathing, dizziness, heavy sweating. About 15% of COVID 19 cases are severe. That means they may need to be treated with oxygen in a hospital. About 5% of people have critical condition and needs a ventilator. People who get pneumonia may also have a condition called acute respiratory distress syndrome. It is a disease that comes on quickly and causes breathing problems. COVID 19 ARDS occurs as a result of an acute systemic inflammatory response caused by insults to the lung. This condition leads to long term breathing problems, and patients with this condition could not breathe on their own and require ventilator. This condition can be fatal, and even if the patients survive, they might have permanent pulmonary scarring. Symptoms include dry cough, decreased sputum production, injury to the alveolar epithelial cells. Specific features of ARDS is low oxygenation index. Chest imaging findings suggest the involvement of both lungs. Chest CT scans usually showed multifocal bilateral patchy shadows or ground glass opacity results to severe lung injury. Blood carbon dioxide levels may be a meaningful indicator for invasive mechanical ventilation. As for the management protocols, high flow nasal oxygen in COVID 19 related ARDS patients is given, and hypoxemic respiratory failure in ARDS generally results from intrapulmonary ventilation perfusion mismatch or shunt and usually requires mechanical ventilation. This reduces the need for endotracheal intubation in ARDS patients and are more suitable for patients with mild ARDS. Secondly, patients could be given corticosteroids, and this is the most potential treatment for ARDS because of their role in reducing inflammation and fibrosis. Other complications include sepsis, superinfection, post intensive care syndrome, delirium, muscle atrophy, and muscle weakness. We will not discuss this as these topics will be discussed by another group. Additional roles of healthcare team is to provide support and rehabilitation, make arrangements for physical therapies and follow-up doctor visits, educate on signs and symptoms of possible complication, reorient and reassess availability of resources in the community, assist patient in adapting to new normal and body capacity. So here is the summary of our case scenario, but if you want to check the whole clip of the case, we will be providing you with a link. So the patient is 73 years old, medical history of hypertension, underwent surgery for adenocarcinoma, and was discharged on the 6th day post-op. On day 9 of post-op, the patient exhibited chest tightness, muscle pain, dry cough, and decreased lymphocytic count. His CT scan findings revealed for viral pneumonia. He was also then tested positive for the COVID-19 test. He then was admitted to the infectious disease ward. After 20 days, he was discharged, and histopathological findings showed focal reactive hyperplasia of pneumocytes with patchy inflammatory cellular infiltration, edema, multinucleated giant cells, protruding hyaline membranes, and proteinaceous exudates.
So, how was the video? Have you learned something new? Now it is time for a simple game. Take out your phones and go to kahoot.it. In order for this group project to be a success, a WhatsApp group has been created and was used as the primary communication tool. Everyone was tasked to find and research about COVID-19 in the community. The group utilized a Microsoft Word document which was shared via Seneca SharePoint, so everyone will be guided where they are in terms of content. Although it was Miss Yi and Mr. Reda who finalized the content, everyone was allowed to edit, revise, and add necessary details they think is important. As all members are already professionals, a laissez-faire type of leadership was observed all throughout this project. Members would send a message via WhatsApp that they had added something, so if there is someone that is available, could follow it up, recheck, and revise if needed. Although there were some members who were not as active in the group chat, most were proactive in replying and would help out members if there is any uncertainty or clarifications that needs to be addressed. The decision for the presentation to be a recorded one was due to the fact that the members experienced internet issues from time to time. Being afraid to lose marks, the group has decided to do a voiceover for the presentation and upload it via YouTube for easier navigation. Moreover, it allows the class to go back at any time to this presentation if needed for reference. Since the classes have become online, the group wanted to be innovative and take advantage of technology to present a creative educational presentation for the class. In detail, this is the outline of the members and what their roles are in this group endeavor.